In this video, we show how payers use Softheon to create a great Medicare Advantage shopping and enrollment experience, all while using the same proven platform that can run their individual and commercial lines of business. Let's take a look at the shopping experience for a Medicare beneficiary who is signing up for a Medicare Advantage plan. The shopping and enrollment experience can be done directly or with the help of a broker. This demo covers both experiences. Let's begin with the shopping portal. The welcome page for the shopping portal begins the shopping and enrollment experience. Payers can configure the welcome page for their own branding and messaging needs while providing important information related to Medicare Advantage products and enrollment. For example, you can see here the payer, a fictional Medicare Advantage health plan called Coverall, provides a redirect link to an information page as well as a frequently asked questions. When the beneficiary is ready to proceed, they enter their location and desired coverage start date. In this case, our beneficiary lives in Christian County, Missouri, with a zip code of 65619. They enter the zip code to ensure that that their correct county is selected, and then they choose the coverage date and click Search. Next, our beneficiary selects a reason for enrollment. If it is outside of the annual enrollment or open enrollment periods, the beneficiary will need to have a qualifying life event, such as an initial enrollment or a special enrollment. In this case, the beneficiary is aging into Medicare. They select the corresponding reason and enter the date of their life event, in this case when they became eligible for Medicare. This ensures the correct initial enrollment period applies. Our beneficiary is now presented with available plans. As you can see from the pencil icons, the shopper can change their information, which will automatically refresh available plans for those criteria. If the beneficiary needs additional information regarding Medicare plans and eligibility, they can use the link on the left. From this page, the beneficiary can compare plans, review plan details, and ultimately select the plan that makes the most sense for them. When they have made their selection, they click Enroll to continue the process. The beneficiary is now given the option to create an account. Creating an account will allow the beneficiary to save the application's process and resume at a later time. In this case, the beneficiary will complete the application in this session and clicks Continue to Application. Alternatively, if the beneficiary prefers to continue an anonymous shopping experience, they can do so, but they will need to create an account in order to save their place and to ultimately sign up for a plan. Here we will continue with creating an account before continuing the application process. To begin the application, the beneficiary confirms their basic personal information. This includes their name, date of birth, Medicare ID number, contact information, and demographic information such as race and ethnicity. The beneficiary will be prompted to review and confirm their Medicare ID number and date of birth. If the information is correct, they click Confirm to proceed. The beneficiary will now be able to confirm their selected plan. If they want to change anything, they would either click Edit Plan. This will allow the beneficiary to change their selected plans. When the beneficiary is satisfied with their choices and information and are ready to proceed with the selected plan, they click Next. The beneficiary is now asked if they have any additional coverage and employment. If the beneficiary wants additional coverage, such as a plan that supports their prescriptions, or a plan that supports other supplemental services such as long-term disability, they can select Yes to the corresponding question and enter the coverage information. In this case, the beneficiary selects No to all of the questions and clicks Next. The beneficiary is now able to search for and select their primary care provider. The beneficiary searches for their primary care provider, Jennifer Smith. When the search results populate and the provider is selected, the beneficiary clicks Next. The beneficiary will now select who is completing or assisting in the application process. Here, important information is attached to the application about the broker assisting the beneficiary. There are two ways the beneficiary can get to this point, as a broker-assisted experience through Coverall's custom broker portal, or directly through Coverall's branded shopping experience. If the applicant started the process with a broker using the Softheon-powered Coverall broker portal, the broker's name and NPN would automatically populate in this section. and brokers or any third party assisting the beneficiary would need to attest that they have seen the beneficiary's Medicare card in person. Because the applicant here is applying directly through Coverall's branded shopping experience, they would add the broker information themselves. They would start by searching for their broker in the search bar. The beneficiary then selects "I am the applicant listed in this enrollment application" and clicks Next. Since most beneficiaries apply with the assistance of a broker, the application provides a final opportunity to assign a broker. If the beneficiary is not being assisted by a broker, they choose No and click Next to proceed. The beneficiary can then set up automatic payments methods to cover their Medicare Advantage policy premiums. Automatic deductions can be taken from a bank account or directly from their Social Security or Railroad Retirement Board benefits. Setting up automatic deductions can account for a more streamlined payment process and for faster effectuation. Here, the beneficiary plans to set up a payment method at a later date. They click Next to continue. When the application is complete, the beneficiary will have the opportunity to review and make edits where necessary. Softheon supports many different ways for beneficiaries to receive correspondence. In addition to printed materials in English, Softheon supports CMS-mandated languages for communication with beneficiaries who are limited English proficient. These languages may include Spanish, Chinese, Tagalog, Vietnamese, and Russian. In addition, Softheon also supports many accessible formats such as Braille, audio, large print, or data CD. The beneficiary makes the appropriate selection here. After agreeing to the Statement of Understanding and reviewing the terms and conditions of enrollment, the beneficiary can e-sign the application and click Enroll Now. The beneficiary now receives confirmation that the application was submitted. They are provided with a confirmation number as well as the option to download a PDF of the application. This concludes our demonstration of the Softheon-powered Medicare Advantage Health Plan Annual Open Enrollment Shopping Experience. Watch other videos to see how Softheon can support special enrollment periods or other commercial lines of business, such as ACA, dental, vision, ICHRA, and small group. Visit softheon.com/healthplans to learn more.